Nigeria's health sector has immense potential, but faces challenges like fragmented supply chains, poor infrastructure, and workforce shortages. Now, addressing these issues requires technology, public-private partnerships, that's PPP, and local production of medical supplies. Digital platforms can also expand access to care, while the PPPs can boost investment in infrastructure. Localizing pharmaceutical production will reduce import reliance and strengthen resilience. Data-driven decisions will further improve resource allocation and the outcomes. Our guest believes that with over 200 million as a population, Nigeria's health sector offers opportunities for innovation and growth. Tackling value chain gaps will enhance healthcare delivery and drive economic development. Is that really so? Is that what's working? Is that how it will be? Newsnight had a conversation with Dr. Abdu Mukhtar, the national coordinator of the Presidential Unlocking Healthcare Value Chain Initiative, otherwise called PVAC. Dr. Abdu Mukhtar, thank you for speaking with us on Newsnight.
Thank you, Nota.
You know, when the president made the statement of, making every aspect of the Nigerian economy and society beneficial or an addition to the economy of the individuals and the nation in general, a lot of people thought this is another political statement. So now the Presidential Value Chain Initiative is coming, and you're the pioneer, is it chairman?
National coordinator.
Coordinator.
Yeah.
Okay. Just like the Presidential Compressed Natural Gas Initiative. Yeah. So, okay. But let's leave the coming on of this. Let's start with you. You're a medical doctor.
I'm a medical doctor.
And now you're turning into an economist.
Yes, I don't...
Or a manufacturer. What's going on? So to walk us through your medical journey to becoming an economist.
Well, I cannot call myself an economist. I can say that I'm just helping to enable a system outside clinical work. But I studied medicine here in Nigeria, in Zaria, Ahmadu Bello University, finished, did my house job in Kano, my NYSC here in Abuja, and then went to the US, where I actually did an advanced degree in medicine. I got a PhD actually in immunology and pathology, where I did a lot of basic science research and also had the opportunity to do clinical work, but I decided I didn't want to do that. So I went to business school, got a business degree, and then started looking at how do you basically bring the health sector, because clinical practice, as much as I enjoyed it, is also, I felt for me, was a little limited. I wanted to do more. I wanted to look at things broader beyond just, the patient, but also the systems, the communities.
The systems that help to serve the patient.
Exactly, yeah. So that's how I just kind of moved after that, and then I went and did a couple of other things.
So it appears the leadership of Nigeria saw that desire of yours to see how the systems that help to take care of the patient work, and they brought you to coordinate this initiative of government.
Yes, they did, but I think they also looked at my experience in the last few years. So before I started this job, I was actually at the African Development Bank, where I was director overseeing industrialization for the bank, so covering many sectors. But among those things, I also oversaw the bank's work in medical industrialization. So during COVID, when COVID hit, the Africa Development Bank wanted to find a way to support countries and companies across Africa to basically respond to that, but also to come up with the solutions, the plan for the future in case next pandemics come on board. So I led that bank's work across the continent, 54 African countries. And that gave me a lot of experience and a window into, what countries, including Nigeria, were dealing with. And so I thought that that experience was noticed, and I'm privileged and happy to be here in Nigeria to lead that specifically for Nigeria. And
I'm sure Nigeria is happy to have you too. But you come in at a time, you came in just after the COVID period. Yes, you had your hands soiled in that COVID period, working. But now you have an opportunity to kickstart or revive what appeared to have been dying. At a point, we had pharmaceutical companies in Nigeria. We had industries that were producing different medical products for the Nigerian populace. But all of that appeared to change at a certain time. Some companies began to leave Nigeria, and that increased the cost of medical produce here in the country. So the presidential initiative, tell us about it, unlocking the healthcare value chain. Tell us about this.
So this is part of the broader...
Does it look like what you were doing during that COVID period under the African Development Bank?
Even more.
Okay.
Because in the African Development Bank, I think the focus, as much as I covered more countries, but the focus was mostly on a few things that I focused on. Here in Nigeria, is a system-wide, country-wide, and Nigeria is also the largest country in Africa, 230 million people. So for me, it's really a privilege that having experienced those things in other countries, but to come to the largest country in Africa, and to be honest, whatever you do, if you want Africa to change, Nigeria must be included. So the president, in his wisdom, President Bola Ahmed Tinubu, His Excellency, established this initiative as part of the broader healthcare agenda. And people ask me, this is yet one more initiative. We've seen this before and again, but why this is different is a number of things. One is anchored within a broader healthcare agenda. So the Honorable Minister of Health, Professor Mohammed Ali Pate, is leading this very bold agenda. It's called the Nigeria Health Investment Health Renewal Strategy and Investment Initiative in healthcare that is anchored on 4 pillars. And people have heard about these pillars, but including things around governance, improving population health outcomes. Then the third pillar of this broader agenda is unlocking the healthcare value chain. And then the last one is health security, resilience, and response to pandemics. And then, of course, there are cross-cutting pillars: technology, finance, and human capital. But so it's a broad, integrated agenda. So I think that people in the past have made a mistake of, look, let's focus on manufacturing, pharmaceuticals, or things like that. Yes, that was good, but just anchoring it within this bigger and broader vision, which the president and the Minister of Health are doing, I think is what makes sense. Because then, you produce them, but also you're looking at the primary healthcare system, you're looking at the health insurance system, how do you enable that? So it's all integrated. The second is, this is a presidential initiative. So we report to the president. I was appointed by His Excellency President Tinubu, and the way this is structured is you have several key people in government or institutions that are actually part of this. So the president delegated his power to the Honorable Coordinating Minister of Health, Dr. Ali Pate, Mohammed Pate, who chairs this initiative, to whom I report on a daily basis. Now, but you also have Ministers of Finance, Minister of Budget and Planning, Minister of Trade and Industry, Minister of ICT, as part of this. You have the Central Bank, you have Customs,
you have the Board of
you have
Intelligence,
FIRS, you have exactly FIRS, you have the regulatory agencies, NAFDAC, you have the research institutions, NIPRID, you have financing institutions, Bank of Industry, NSIA, and MOFI. So the idea is, and private sector representation, very important. The idea is whoever needs to be around the table for key decisions to be taken should be taken. In the past, you have the Minister of Health saying, oh, this is manufacturing for vaccines. But then the Minister of Trade says, but this is manufacturing. I am Minister of Trade and Investment. But now everybody's on the same page, and the president is looking at everybody. And so this is how we are structured. And we in the PVAC, my team and myself, we are the secretariat to make sure that decisions that are taken at the highest level are implemented, are executed. We are the outward face. We go and form the partnerships.
So if I hear you correctly, this is beyond investment in Nigeria's health system. It's beyond just manufacturing.
We like to call it sometimes medical industrialization. So when you industrialize countries, there are countries industrialize. Industrialization is Africa is behind in terms of industrialization, but again, it's also not rocket science. Sorry to say this. Countries have done this. Some of the things that we are trying to do.
Done what? Pharmaceutical manufacturing, or equipment manufacturing, or personnel training.
everything. And let me tell you even why we're doing what we're doing, in addition to the whole idea that we need to industrialize. What do we even need to industrialize? We import 80% of the medicine that we use in this country. We import almost 100% of the vaccines that we consume in this country. We used to produce yellow fever vaccines in Nigeria, in the 70s. Now we don't produce a single dose. We import about 99% of medical devices, including test kits. Now, we're a country of 230 million people. Nigeria is the only country in the world that has at least 100 million people that does not produce at least majority of the healthcare products that we consume. To be clear, no country in the world produces 100% of medical products that they use. All countries import, even the advanced countries, they usually produce maybe about 80, 85%, but they still, that 10, 15%, they import to fill in the gaps because they are not competitive. The technology does not exist in their countries. But for a 230 million people country to be only producing less than 1% in some product classes or 20% in some areas, is just not sustainable. There's no security. The public health rationale is not there. You even cannot get money out of this. I remember when I told you about my work at the Africa Development Bank, how we were running helter-skelter across the world trying to help African countries, including Nigeria, acquire the basics, PPEs, the mask, the gloves, the hand washes, the alcohol, whatever, running around. I remember I was on calls late night, early morning, calling China, calling New York, trying to organize all of these things for African countries. This is not tenable, and we saw what happened when COVID hit. Most of the countries from where we were even buying, they said, well, let's take care of our people first. You guys, you wait. And we waited. And our people died. And thank God, COVID was not as big a disaster as for us as it was for other parts of the country. But we cannot wait. We cannot say, so this is why we're doing what we're doing. And the mandate of the presidential initiative, the president gave us 3 very clear mandates. Number 1, he says, reverse those numbers. I don't want to see them anymore. So by 2030, we want to be able to reverse. So instead of producing only 30% of what we consume, 30% of medicines, we should produce 70 to 80% here. And then if we want to import, so just basically reverse the numbers. And we have very clear targets for that. The second KPI, directive from the president, is to reduce outbound medical tourism. So in this country, every year we spend almost $2 billion on outbound medical tourism. Nigerians going to countries, I don't want to mention any country name, but for things that really, and often what happens, Nigerians go to those countries and they're looking for the best doctor, the best cardiologist, the best neurologist, the best neurosurgeon, most likely Nigerian. So we have we have all of that. And so how do we save some of that $2 billion to make sure you do that? How do you do that? You build the infrastructure. Make sure that your hospitals are well equipped. They are world class. They have the right people. Your diagnostic centers are well equipped. A lot of people go abroad for medical care because they don't trust the system. They don't trust that they get the correct diagnosis. And everything in medicine with the patient starts with the correct diagnosis. So that's key KPI number 2. The third one is to create jobs. We need jobs in Nigeria, badly need jobs, skilled jobs. So in the health sector, along the various parts of the value chain, where are the jobs? We need to find them, we need to create them. And then while we're doing that, also attract foreign direct investment, mobilize local resources. So these are the 3 mandates that we have in the initiative. We was established last year in October. We started end of January actually. So we're still less than a year into the implementation.
Okay, you talked about some of the things you do and why you do them. You said something about by 2030 to have reversed the numbers. So let's have manufacturing of products for Nigerians at 70% instead of importation. But you also talked about ending medical tourism. How do you intend to end medical tourism? Seeing that the Nigerians, the mindset of the average Nigerian is anything from beyond the shores of this country is better than whatever we have here. And you find out that, as you said, indeed, the best of this, the medical personnel and indeed the engineers and all of that out there are actually Nigerians. So how do you intend to go about turning that mindset? Because it's a mindset thing.
It's a mindset, yeah.
How would you turn the mindset thing when it looks like the leaders who are giving the instructions are still going out for these things they say Nigerians shouldn't?
Yeah. So look, a good question. And the Minister of Health was asked this question last week in an interview, and he addressed that. First of all, this is not something, everything that I said here is not something that we can do tomorrow.
Yeah.
Or in 6 months or even in a year. We are embarking on a journey that is deliberate. I think that people have options to do what they want to do. You know, people, whether you have the best medical care here, people may still decide to go. And medical tourism is not a phenomenon only for Nigeria. In the United States, you know, a lot of Americans actually travel out of the US to go for medical tourism. They go to Turkey, they go to Latin America, Brazil, they go to Europe, you know, they go to other places just to get medical health care. So it's not really a bad thing. What we want to do is to make sure that people have the choice, so that people are not doing, if people decide to do medical tourism, they are not doing it because they don't have the option or because they don't have the right kind of system or infrastructure here. At the present, most people, Nigerians who go out for medical tourism, most of them go really because they don't either trust the hospitals because the hospitals are not good enough, or because the infrastructure is not there. Sometimes you have something that says, look, we cannot do anything here. You have to go, but you know, go to this country. So what we are trying to do and how we are going to end it, and we're not going to end it, we're not going to bring it down to zero, because there will still be people, and this is a democracy. People can decide for various reasons. I know people who had lived in particular countries for years. They've established relationships with doctors, with healthcare providers. And so they now move back several years to Nigeria, but they still, because there is trust established, they still want to say, you know what, I want to go and see my doctor because this is a person who's known my history, clinical history, he knows, you know, my medication, whatever. So there is all of that. What we're trying to do is to make sure that the hospitals are there for specialization, for example, you know, cardiology, oncology, hematology, and we see a lot of that. And we are encouraging and we are working, even here in Abuja, I tell you, right now there are about 3 big hospitals that are certain facilities for oncology, cancer, for hematology, for cardiology, heart disease. I visited those hospitals. I tell you the kind of equipment that I saw. That's the best you can see anywhere in the world. The same manufacturers, global manufacturers. So if you are in Nigeria, and these hospitals are completed, and you know 2 of them are really about to be completed, I think the middle of next year, why do you need to even go out? So we want to provide those options, and then people can make their own decisions.
Dr. Mukhtar,
Yeah.
when you talk about what's available and what could be available, there is a school of thought, I'll tell you, that Nigeria as a country has, in every state, for want of a better example, at least 1 federal university.
Yeah.
And each of those universities has a medical school with a teaching hospital. One would have thought that one of the first things that PVAC will be looking is to look at how to re-equip or upgrade the equipment in these various federal teaching hospitals. So that anytime anybody needs anything, no matter what it is, just say, go to, for want of a better example, University of Nigeria. Go to Ahmadu Bello University Teaching Hospital because the equipment is there. You said 3 hospitals. Are they government owned?
No, these are private hospitals.
So why isn't the government, or is that part of the mandate of PVAC to see this government teaching hospitals get their equipment upgraded to that global standard?
So the reason why I mentioned these hospitals, and I just said 3 in Abuja, I didn't say 3 in the whole of the country. There are other hospitals out there. In PVAC, we are focusing on mostly mobilizing private resources. But what I told you at the beginning is the healthcare system is integrated. The Ministry of Health, they are making massive, huge investments in upgrading infrastructure for teaching hospitals, for those tertiary facilities. Right now, you know, we're building, the plan has been done, the president has approved the ministry building 6 cancer centers in Nigeria. 6 cancer centers. You know, this is huge, and each one of them will service an entire geopolitical zone. And these ones are going to be done. The contracts have been signed, equipment is being sourced. The NSIA is leading that implementation. Money has already been released. So that is happening. On the teaching hospitals, huge investments, billions. I cannot tell you the numbers, but again, so that's what I tell you is a whole system. There is focus on the public hospitals. Tertiary hospitals is doing, and it was an excellent question you asked. Those need to be upgraded because not everybody can go to the private hospitals. But I want to also make sure, wherever you are in Nigeria, you have the choice. You have that choice. You can go to these teaching hospitals a lot, like almost in every location in the country. That is being done. And then there are other parts, the health insurance system. So how do you even access that care? You go to these hospitals, either private or public, and then you have to pay money, and then you cannot pay money. But that's why we have a health insurance system. That's why there are a lot of massive reforms that the health agenda, the minister is leading with the NHIS, Health Insurance Agency, NHIA, that's leading to also make that available.
Again, so again, the health insurance is there working, and the ministry is leading that with NSIA and all of that. But again, you find out that most of these hospitals where Nigerians are going to get the kind of treatment that they would want are private concerns.
No. Well,
I'll say it again.
Maybe
most of them, because by the time they go to the private concern, they go to the government-owned hospitals. They'll tell you that some of those things they require, some of the machinery they need for the kind of ailments that they need attended to, are not available in those private.
Those hospitals are being equipped. The infrastructure has been upgraded. They have been equipped.
So is the PBAC mobilizing the investments in those government hospitals as well? Or is it mostly private?
No, mostly private. So PBAC's role is to mobilize resources, private resources for people to make investments.
Okay.
So if you come and you want to make an investment, you want to build a new hospital, PBAC can help you. If you want to upgrade your new hospital or to equip it, PBAC can help you.
It will help you in what way? Tax.
There are many ways, and I will tell you some of the things that we
tax waivers,
a lot of things, and we addressing policies, we're mobilizing financing, we're trying to make the environment right for everybody. So we're doing all of those things for the private sector. In public sector, again, there is a public part of it, which again to be the public spending. Government, so private sector spends a lot of money. Bulk of healthcare is delivered through private, but the government also expenditure in healthcare, especially in the last 1 to 2 years, is actually very, very huge. So what we're doing is, in terms of resources, mobilizing resources, financing, we talk to different financiers. So an example, Afrexim Bank, we have a $1 billion facility with Afrexim Bank that will be channeled into investments in healthcare in Nigeria, $1 billion. European Investment Bank, we've spoken to them. We're discussing a pipeline of projects. Africa Development Bank, where I came from, we're talking. Islamic Development Bank, I just got a call a few days ago. They want to come to Nigeria to look at opportunities. We're talking to private equity funds. We're talking even locally, Bank of Industry, because they have they support healthcare. NSIA, they have a whole healthcare program. So we are mobilizing those resources. Our commitment to Nigerians, to all Nigerians, is if you have a program or project in the healthcare sector, whether it's in manufacturing for pharma or vaccines or whatever, or health infrastructure, diagnostic centers, hospitals, whatever. If it's a project that is feasible, that is viable, then money should not be a problem.
It's been an interesting conversation, all the areas we've covered so far. Why? And hold on. When you were growing up, did you ever think you'd be a doctor?
Honestly, not.
What did you want to be when you were growing up?
I wanted to be an engineer.
Oh.
Yeah, because engineering, I was stronger in the quantitative subjects, math, physics. Those were my favorite subjects.
Okay.
But then I also almost loved all subjects equally. I went to a science secondary school in Kano, and then so I went to study medicine because medicine is prestigious. Everybody wanted.
But engineering is also prestigious.
So I did medicine, but I think engineering would have been my natural home, or even just one of the single.
And so this project you're handling right now is like you're merging the two.
Imagine the two.
A bit of engineering here, a bit of project management, and all of medicine.
Policy, everything, and even more. Yeah, exactly. Which is what I like about the job. Yeah, to be honest, because it deploys everything.
Oh, cool.
You know, yeah, okay. Business, medicine, policy, healthcare, some little numbers here and there. So,
so seeing that this is what it is, and you're enjoying what you've done. Before we went to that break, we were talking about how the private companies are basically mobilizing private investment into the healthcare sector, into the health sector in Nigeria. You talked about what you're guaranteeing, what PVAT's guaranteeing them, funding, waivers where need be, approvals where need be. Basically just creating an environment where they can just work in and do what they need to do. The question I'd like to ask you, what guarantees are these concerns giving to Nigeria and her people? Are they guaranteeing jobs? Are they guaranteeing good welfare? Knowing that, for instance, in some parts of the country, we've had individuals or foreign investors come in, set up industries, and they're treating Nigerians horribly.
Well, I don't know about that. Maybe those are allegations. But look, why do you need... These are private companies. They're running businesses. Right, so when you run a business, you establish a business, you will create jobs, and just those jobs will go to Nigerians. So right there for me, that's good. They will employ Nigerians. Those Nigerians will pay income tax on their earnings. They will get that. Any company that is sensible, knows what they're doing, they will have a set of policies and rules that guide their operations. If you are treating your people well, it's on you. People will leave you. They'll go to another company. So what we are trying to do by enabling that environment, helping those companies set up, we're creating also a level playing field. So we are not creating monopolies. So if you are a company that is treating people not well, people will leave you. And this is an industry where, skilled labor, talent is huge.
Considering the mandate you have, going by the president's statements to ensure that every sector of the Nigerian economy comes out beneficial to the Nigerians. Right. Don't you think it would be a good idea to also put it down in their workability plans, for instance, telling the regulatory agencies to ensure that Nigerians who are employed there are paid a certain amount, their welfare is given priority, and they are treated properly? Don't you think that would also enhance the work you do?
It's important, I think so, but it's also one government, so they are all parts of government. When you establish a company, of course there are laws and regulations in the country, whether they are labor laws, whether they are policies or whatever. There are things existing already that guide how companies should behave in any sector, whether it's pharmaceuticals or whatever sector. And I would insist that whoever is doing that, they should abide by the code of conduct of how companies should behave. Of course, before we even partner with those companies or before we even try to bring them, of course, you do your own due diligence. So if a company is shady in the first place, we have no business dealing with shady companies. But in our due diligence, we look at if there are companies that are already operating or they have operations outside, we already know what kind of company is it. So even our selection criteria will, to some extent, actually weed out, companies that are not likely to support our aspirations as a country, because that's very important, because that's the president's agenda and the whole country's agenda. So we do that. But also, when you're operating as a company, of course, you follow and adhere to certain rules and principles about how you employ, how you treat people. There's a minimum wage requirements that everybody has to abide by. So for me, those things are really given. They are given. They'll be there.
So since you came in, it's been about a year.
Yeah.
What challenges have you had to deal with in pursuing this mandate of unlocking the healthcare value chain?
Yeah. Look, there are challenges, whatever job you do, but we love the job that we do because we're seeing light at the end of the tunnel. We're seeing possibilities. When you start doing this kind of thing, there's a lot of skepticism. So one of the challenges is just people not even believing that this is different because, subsequent previous governments have promised one thing or the other. But for me, I tell people that, the political will that we see from His Excellency the President, from the Minister of Health, from everybody, from partners, I think that this is different. We're disrupting the way things were being done. So one of the challenges, of course, that we faced at the beginning is just even establishing ourselves as a credible entity. Because again, like you said, people say, "Oh, we've had that before," but that challenge within a year is actually overcome. People are coming to us. Partners want to work with us because we have actually just rolled our sleeves. Did the work that needed to be done. People are seeing big progress. The executive order is huge. This is the kind of thing that you can take 2 to 3 years even to get there. But within less than a year, we now have an executive order that is really shaping that industry, that is creating new markets. But we're also mobilizing. I went out in the field 2 weeks ago to Lagos, Shagamu. Just visited a couple of manufacturers. What I saw was amazing. Just, I honestly, I doff my hat for our manufacturers in the healthcare sector and the private in pharmaceutical manufacturing and those trying to do things in this sector. They are looking at this is a business, but they also know that these are healthcare products. So these are people who are committed, who are passionate, who want to help humanity. So it's not just business, let's make money. It's more, how can we provide products that people need to remain healthy and to stay alive. So for me, that's really an eye-opener. So that challenge number one, establishing, getting on the map, which we've already overcome. The second one, obviously, is just also as people also realize what we can do. So people are coming to us. Everybody's coming to us with one idea or the other, which is good. It's exciting, right? But also at the beginning, making people understand that this also involves hard work on our part, on behalf of the manufacturers, on behalf of everyone. This is not a program where we do the usual government intervention, where we get billions from wherever in government, and then we have discretionary power to choose our friends or whoever, family, and then invest to people who just from nowhere who say, "Oh, I want to do manufacturing." You have to work hard for this. We'll mobilize resources for you, but your business has to make sense. You have to have a good business plan, those kind of things. So getting people to understand that I'm not here, or we are not here as a team to collect money from government and dish it out. We're trying to create an enabling environment. We're trying to mobilize resources for you, but at the end of the day, you also have to do the hard work to do this, to deliver, and to have the right commitment and to have the right business idea. I told you I went to Lagos a few weeks ago. One of the other things that we did here, we said, let's also look at the smaller guys, people with small ideas. And we did a Shark Tank-like event where we said, look, let's bring people with ideas, let them come and present to us. And we, within a few days, mobilized about 100 companies. We couldn't even do so. We chose 14 companies and asked them to present. And we got a panel of judges, including a former Minister of Industry, a Commissioner of Health in one of the biggest southwestern states, people in private equity, people who understand business, to say, be like the judges for this. And I tell you, the kind of businesses that we see in Nota is really amazing. I was blown by the quality, young Nigerians, men, young boys, young girls, the ideas that they have. Things that really, if they're given a chance, they can transform. These are transformative ideas. And we met with them, we listened to them, we gave them feedback, how to improve, and we're going to actually carry them on a journey to see in the next, whether we'll be able to get them to bankability so that we can get them money and see where they get. Even if one or two of those 14 companies get to do something big, it will transform healthcare, not only for Nigeria, but for Africa, for even the whole world.
The healthcare or the health system also includes the food that's consumed.
Absolutely.
And Nigeria is I don't know whether to call Nigeria an agricultural nation, but Nigeria has huge potentials in agriculture. I mean, for years, Nigeria was exporting groundnuts from Kano. Now, the matter of the value chain in the agricultural sector, does that also concern PVAC? I mean, when it's not just enough to harvest the products, is PVAC involved in seeking to get the value from those products before they even go out? Starch, for instance, cassava starch used for pharmaceuticals. There's also, what else? Ethanol used for pharmaceuticals as well. So Is that also part of what you do? Are you looking towards that? And what kind of investors are you getting to come into all of this?
Yeah, so the short answer, excellent question. The answer is yes. Even though we're called unlocking the healthcare value chain, but the healthcare value chain is just beyond just the products, the medicines. And you sounded like a pharmacist. I don't know that you said a pharmacy, but
thank you very much.
All the things you call, sometimes we call them excipients. So these are the things that you attach to the API, the active pharmaceutical ingredient. You attach all those things. Those come from agriculture. So it's also in our own interest to support that. The NSIA, Sovereign Investment Authority, which is also part of this initiative, is actually have a big program to develop and establish plans for precisely this, to develop the excipient using starch. Actually, the starch is one of the products they are trying to promote. Nutrition, health, nutrition, there's a big relation, but the nutritional products are agri products. So how do you mobilize those ones? How do you bring everybody? So we're seeing, again, it's integrated. In the health sector, we are implementing what we call a sector-wide approach for health, but also it's just beyond, health touches everything. When you talk about the human capacity, it's education, right? When you talk about, again, you talk about even the food, the nutrition products, the things that you attach to those products, these are all agriculture. So this is holistic. And I think what makes it also interesting, and I think the president is aware of that, everybody's aware of that, is the Minister of Health is also coordinating minister. So coordinating minister gives him that ability to also mobilize these other sectors. And he works very well with many of these ministers and the ministries, and we work. And again, that's why it's a presidential initiative. So everybody is on deck to make sure that we deliver and enable and enhance as many sectors as will allow us to do. Because the human being will eat, will take medication when they are not feeling well, they'll clothe. So you don't say I treat things in silos. Everything is integrated.
All right.
Yeah. We, right now, so one of the things we're trying to do is to create what we call a pipeline of projects. So projects that make sense. We have hundreds of projects that people come and say, we're interested in this in all different areas. But in terms of high quality projects right now, as of today, we have about 56 solid projects. These are projects that are either at stage of being bankable. Bankable means then, every bank will be running and saying, oh, take the money, we are ready. Or about to be bankable. 56 projects. 35 of these projects are local companies, Nigerian companies. Kudos to Nigerian entrepreneurs and business owners. 21 are foreign, so that's 56. Total value of all of this, about $3.1 billion US dollars. 800 million for the local companies, 2.3 billion for the foreign companies, 3.1 billion, just the projects, not the total value. Of course, when you do, you create a lot of value. All sectors. So typical examples. The one that, we've announced recently during the UN General Assembly, a partnership with Vestager, a company called Vestager. Nigeria has 25% of the global burden of malaria. So 25% of malaria cases in the world are in Nigeria, given the size of our population and also the vector dynamics and the epidemiology of the disease. Bed nets, when you talk about malaria prevention, and there are many tools to treat, to manage malaria, to vaccines, drugs, all sort of things. But bed nets, chemically treated bed nets is one of the best ways to prevent malaria. We do not produce a single bed net in Nigeria today that is pre-qualified, that is meeting the right technology. So what have we done? We reached out to Vestager, which is the world's largest producer that has been producing in Vietnam and China and importing to us. And we say, you have to come here and do it. Whatever you need, we provide them all the necessary things. We signed a partnership. They identified a local partner in Nigeria. I visited the site in Ogun State 2 weeks ago just to see for myself. They have acquired, sourced their financing from a U.S. development finance institution. They're looking at price guarantees to make sure that they'll be producing within some particular range. So everything is in place. This company is coming. In the RDT, rapid diagnostic tests, where you can just test quickly for malaria, for HIV or STIs and other things. We have on ground about 3 solid companies that are already willing, and they have done their business planning. They have found local partners. They have acquired the technology, because some of this requires some technology transfer. And they're willing, they're ready to come. They have their financing. They will start breaking ground very soon. Hospitals, I mentioned this earlier. We have people who are coming to build specialty hospitals for oncology, hematology, cardiology. We have all those. We have random projects, snake venom, which is, it's a huge problem. Yeah, it's anti-venom, producing the anti-venom. We have already, I think, about 2 companies that are serious that want to come and establish capacity here. We have in the pharmaceutical sector, our own local manufacturers. Again, I visited sites. We have companies here that are really, they are pioneers in what they do in Africa. There aren't too many companies producing APIs, active pharmaceutical ingredients. So most companies import this, but we have about 2 or 3 companies here in Nigeria that have already acquired the necessary partnerships and technology to start producing API. And that API is not going to be only used for Nigerian for themselves, for Nigerian companies. They can become the hub for producing those APIs for really essential medicines across the continent. So we are seeing a lot of this. Where will I even stop vaccines? We already have 2 companies.
Right now, I know that the malaria vaccine is coming already.
Yeah.
It's already being deployed. So how soon would we begin to see vaccines being manufactured here? Also, remember that during the COVID period, there were some people, some local Nigerians, some local individuals and companies who said they had the solution.
Yeah.
Did you get any proposals from some of these people to look at and say, okay, are there potential manufacturers in these numbers?
We have, on the vaccine side, about 3 proposals. And these are not just any proposals. These are proposals from 3 solid companies. And I don't want to mention names here, but these are companies that have, they have technology arrangements. They are already talking financing. One of them is being financed by a Fraxim Bank independently. The other one is being funded by an European institution. So we've seen evidence there's money. They have acquired the technology. One of them, not far from Abuja here, actually already has found a site to do things. So we're seeing credible companies, about 3 companies that are willing and starting to want to produce vaccines. Now, vaccine production is not an easy process. It's a biological substance. You need to make sure that the quality is there. You need to make sure NAFDAC is ready to even regulate those vaccines. They're trying to build the capacity for that. So it's a journey. I cannot tell you how long, but our projection is about 3 years from now, maybe you will have vaccines being produced, at least in some certain areas. Now, will the project start earlier? Absolutely. I think that one of those companies, by sometime next year, middle of next year, maybe we'll start doing the work, construction, acquiring the equipment and putting that foundation. Now, when will the vaccines be ready? Maybe, I don't know. Again, honestly, I'm speculating, but our estimate is maybe it's a 3 to 5 year play.
When you say 3 to 5 years, that's the manufacturing, or 3 to 5 years to the approval stage?
No, to manufacturing. Many of these companies, approval meaning what?
Meaning that they've manufactured, they're probably in the testing phase, waiting for the regulator to say, go.
Some of these vaccines that are already being used somewhere. So the technology is there. So there is going to be just a partnership agreement. Technology transfer, but obviously NAFDAC and all the regulators will have to regulate. We have to make sure that there is what we call bioequivalence and all the tests that need to be made. I think that is all taken into consideration. Again, I'm speculating. I'm not talking for the manufacturers, but given what we see of the plan that they have, I think that is the play. But beyond just also manufacturing those vaccines, one of the things that we're doing in the initiative is to lay the foundation for the future, for where things can go. And, scientists say mRNA will be a key part of the solution to producing vaccines in a faster way, more efficient. And so we are laying the foundation for mRNA vaccine production outside these companies that we're talking to. And one of the ways to do that is through research and development. So we signed an agreement with a company called Universals. It's one of the world's largest honors of mRNA technology based in Belgium, where they will come and establish a platform for mRNA vaccine production. And that is happening early next year. We already have a training plan because, again, when you build these plants, you do things, you have to train the people. These are skilled jobs. But we already have a training plan developed. We'll get scientists and relevant people from universities.
From Nigeria?
From Nigeria, absolutely. Everything from Nigeria.
Is it going
Why
to
should we train
get scientists? Are you going to spread it across all the universities in Nigeria?
Yes, so we have a first phase where we will start maybe about 30 to 50 people, and then we do 100 and 200. But these are really highly skilled.
When I say 30 to 50 people, phase one, are they going to spread them across the country?
Yeah, absolutely. We'll make sure that there is coverage from every part of the country. We'll bring them together. We'll train them. We have a partner institution here in Abuja that they've already signed a partnership agreement with Universals for this training. Is taking place.
So in a year, you sound like you're actually, how the chimpanzee or the ape would beat his chest. So you're beating your chest that you're on course.
We're not beating our chest. No.
Okay.
Because we're just starting. We feel that, there is a lot of work to be done. It's not going to be easy. So we're just doing things, but we are creating foundations and fundamentals. That's why we call it ecosystem building.
Are these foundations and fundamentals, are they sustainable?
Yes, they will be sustainable.
There are documentations to ensure that one won't just get up. Let's just say tomorrow the president is convinced to move you from here to somewhere else. There's a document on ground that anybody coming in can run with. Absolutely.
This is not a one-man show. This is not about me or about any individual. This is about creating a system. It's an initiative. I have a solid team here that have been driving this work. We have partners everywhere. Everything will continue. This is absolutely not about any single individual, less so myself, and it's very sustainable, and things will continue.
Thank you very much.
Thank you,
Mukhtar.
Thank you. Thank you, sir.
That's the show for today. Thank you for being a part of it. We will love to hear from you. Our handles are right there on your screen. Send a word on X or on Instagram, or even a long email. You can also watch this again, and indeed all the other conversations that we have had. Just go to our website, channelstv.com/podcast to get started, or youtube.com/channelsweb. Until we bring you a fresh conversation, it's bye-bye.